Greetings, everyone. We have with us now a special guest who has joined us for the inaugural session to kickstart our most awaited virtual national conference. Despite being an otherwise progressive household in Mumbai, India, even Swara's family could barely discuss the topic when she got her first period. Not only was the menstrual taboo real and pervasive in India, but period poverty was just as prevalent. In May 2019, Swara officially founded the Period Society, a non-profit organization promoting menstrual equity, combating the taboo surrounding menstrual, sexual, and reproductive health, and eradicating period poverty throughout India and the world. The Period Society trains youth in rural India to lead educational sessions with OBGYN vetted modules. They have educated 50,000 plus individuals worldwide, distributed eco-friendly period products to 40,000 plus menstruators in India, and replaced 700,000 plastic pads with sustainable alternatives. They have been recognized for their work by numerous organizations. Novartis Reimagining Healthcare Scholars, Prince Harry and Meghan Markle, the One Young World Manchester Summit, the Diana Award for Menstrual Policies, and many more. The Period Society now has 40 youth led chapters and will expand modules and training to address domestic violence and safe sex and work on policy campaigns to combat systemic barriers to sex education and reproductive health in a holistic, gender inclusive way. I introduce to you all Miss Swara Patel, founder and president of the Period Society. I would like to invite her to the screen to enlighten us about her topic for today, the role of youth for a menstruator friendly society. Over to you, Swara.
Hi, Sabhagya. Thank you so much for that lovely introduction and to Sarkari School for having me here and giving me a chance to speak about my work and what the Period Society does. So you've already done a great job at describing everything that the Period Society has done and highlighting some of our impact. But I think especially when we talk about the role of the youth for a menstruator friendly society, um, it's really important to go and do the why behind our what and how we do things at the Period Society to achieve our mission of putting a period to the stigma, pun intended. So, like you mentioned, I grew up in Mumbai and Seattle. I was 16, and both of my parents are healthcare professionals. At the point that I got my first period, I think I was in the seventh grade, and my school had given us absolutely no education about menstruation or even, ever like said the word period aloud and discussed menstruation with us. And as a result, a lot of the girls in my class who were getting their periods were severely misinformed about their body. And there was this sense of shame and this pressure to conceal the fact that we were on our periods when we started menstruating. And a lot of us have memories of, trying to ask someone for a pad when we forgot one in school in really hushed, whispered tones, or, hiding our pad like in our uniform pockets and running to the bathroom hoping that it doesn't fall out or someone doesn't see or laugh at us, or really panicking when we like stained our uniforms. And there were a lot of absurd superstitions that came along with menstruation, and even some restrictions that my own family imposed on me when I was in my period. And I was asked like not to go to the temple when I was menstruating, not to participate in certain festivals, not to discuss any issues that I was having about menstruation with my dad, who's a physician and should be the person prescribing me medication to help with my period pain, because it was considered improper or impolite to discuss menstruation publicly, especially with men. And for a long time, I sort of like gave into those taboos, even though they didn't sit right with me, because I didn't know better and no one actually explained what menstruation is or presented it to me as a very normal biological process that's essential for my health. And just with the ignorance that I had, I kind of gave into all of these taboos because menstruation was always presented as this thing that sort of made you impure, or as something that was dirty. And just that combination of ignorance, surrounded by the cultural taboo that comes with menstruation, leads to a lot of menstruators in India following all of these superstitions. And I was always very privileged in the fact that I had ready access to period products. But when I was volunteering at hospitals as a 15-year-old, I met this lady at a cancer research center in Mumbai who came from rural India and had basically traveled all the way to help with her son's cancer treatment. And in that process, she'd exhausted all of her savings. And during one interaction, she was having a particularly tough day. And as she opened up to me, she told me that she was on her period and she couldn't access period products because of the cost of living in Mumbai. So she had a piece of her old sari that she was using to manage her periods, and basically taking public transport in the sweltering heat all around the city to buy his medications, take him for his appointments, and in that process, um, also trying to manage her period without access to period products. And if I don't have access to like a period product maybe for 20 or 30 minutes because I forgot to take one with me to school, or forgot to keep one in my bag, like I know the sense of like panic and anxiety I feel until I actually like get my hands on one from a friend, or I'm able to purchase one. So to think that there are people who actually like have to go through the entire menstrual cycle for years together without having access to period products, and how they're able to like go about their daily lives, without having access to something as basic as a pad, was something that was really, really jarring to me. And the more research that I did into this, I realized that it wasn't just a very individual like problem with this one lady I had an interaction with, but there are over 23 million girls in India, according to a report by Dasra, who drop out of school every year around the point that they get their first period, because they can't access period products. The schools don't have washrooms or sanitation facilities for them to manage their periods. They're misinformed about menstruation, and there are even certain communities in India where people who menstruate still isolate themselves in period huts while they're menstruating to prevent contact with other members of the family because of all the superstitions that go along with menstruation. And in terms of combating this problem, once I finally understood what menstruation was, because my school had to introduce the topic to us in the 10th grade because it was going to show up in our board exams, um, that realization finally hit that this is a very normal biological process. Menstrual blood, in fact, isn't dirty blood. It's the same blood as the blood that flows through the rest of your body, along with uterine tissue. And empowered with that information, I began to question all the taboos that I was introduced to at home and within my community. And a combination of all of these experiences motivated me to start the Period Society as a 16-year-old. And we really focus on education as a nonprofit, that too in regional languages, using visual aids and diagrams, because um, in a jargon free interactive manner, we want people to understand what menstruation actually is and what the process of menstruation entails, to empower them with the information and the agency to actually break away from a lot of these taboos that surround periods. And a reason that these menstrual taboos have been perpetuated for so long is because a lot of schools in India lack a mandated sexual health curriculum, or don't comprehensively cover topics such as menstruation, especially at an early age, before young girls especially start menstruating and understand what their period is. And it's really important for young people to kind of step in and break that generational gap in knowledge by educating themselves about menstruation, or having access to education about menstruation if their school or their parents aren't going to talk to them about it, and then b taking on the responsibility to educate those around them who might not know what a period entails, so that it's a normal biological process, who might still follow all of these regressive practices surrounding menstruation, by empowering them with information about what menstruation actually is. And I think that also has to be a cultural shift in how we look at menstruation. So there's still a culture of concealment, and one of India's leading sanitary napkin brands is actually called Whisper, which is just very reflective of the way we think about menstruation. And if you looked at advertisements that come up for a pad company, you'll always like notice this blue liquid being used. And as a child who didn't know about menstruation, I used to be very confused because I always like wondered, why do these women like in their mid 20s like need adult diapers, because I could not like figure out what this blue liquid was. And I think thinking about menstruation and menstrual blood and the whole process is something that's really normal. Also, comes with doing away with the euphemisms that surround menstruation. So we never use the word period aloud. We'll always use the euphemism like mahina or undano ki baat instead of just saying the word period. And we usually use euphemisms for words that are considered improper or dirty or things that we're ashamed of to kind of present it in a more polite way. And I think saying the word period aloud and kind of doing away with all of those euphemisms would be like a really powerful cultural shift in normalizing menstruation and normalizing attitudes towards menstruation. It was definitely not something that I was very comfortable doing when I first started my period, and I would like try to avoid saying the word in public at all costs, and I'd flinch when I had to say it in front of a man. But I think over the years, like especially doing this work with the Period Society, it's a word that I don't think twice before saying out publicly, even to a very large crowd, because now it's just something that's really, really normal. And it's part of like my life's mission to normalize menstruation through my nonprofit, and also by empowering other young people in India to step up as leaders in their communities and combat the misinformation surrounding periods. And I think I'd like to keep it short and sweet, and save some time for questions. But just a last piece that I wanted to touch upon was, a lot of times young people will approach us to be a part of the Period Society, or even in personal interactions ask me, Swara, do I need to start a nonprofit if I'm passionate about combating menstrual stigma, the menstrual taboo? And I think while that's one way to go, to be associated with a nonprofit or to start one yourself, it's absolutely not necessary to have an impact. Everyone is capable of having an impact in their own way by just beginning to normalize menstruation in their own circles, or educating younger kids or younger siblings or other people in your family who might follow aggressive practices surrounding menstruation, and normalizing menstruation in your own friend circle and within your own family, making your workplaces more inclusive for people who menstruate, by making sure that period products are freely available in restrooms. And these are small steps that basically anyone can take, and you don't necessarily have to think of yourself as an activist or someone who's like associated with a nonprofit in a formal way. But if all of us begin to do these things regularly, I think as a society we'll begin to normalize menstruation and see menstruation differently, and it can have like a really, really huge ripple effect. And I think that's really what we need to put a period to the stigma. And with that, I would love to take any questions, or hear your thoughts or hear what anyone else has to say.
I have a question for you, Swara. When it comes to the topic of menstrual health, we usually see women who are taking the first seat. Ever since you started working with the Period Society, what changes have you seen in the mindset of men starting from 2019 till 2023? Have you seen any changes? Have you seen more men contributing in terms of period health and period awareness?
Yeah, I think that's a great issue, especially because I think menstruation and like menstrual rights are like really, termed as a women's issue. But I feel like there are a lot of menstruators who don't necessarily identify as women, and there are also like a lot of women who don't menstruate. And on top of that, I think um, you know having access to period products is really a human right. And if we have to change how society looks at menstruation, then men and boys are absolutely a part of society, and like they're part of like normalizing periods and breaking the menstrual taboo. So I think for me, change really begins at home. So before I go out and preach to someone to normalize menstruation, it was very important for me to change the way it was viewed in my own house. And initially, when I got my period, there was always this level of awkwardness between me and my dad when I had to go to him and tell him that I had period pain and I really wanted medication. And sometimes I felt like he'd be dismissive and he'd tell me to go talk to my mom and ask her for medication. And I remember once I like snapped and I told him that, you're a physician, you've studied the human body, you know that this is a very normal biological process. But if you're going to have this attitude where you'll kind of dismiss my period pain or you'll tell me not to talk to you about it because it's a girl thing, then is this something you do if your patient approached you with a similar complaint? And a lot of my dad's patients, also like come from this urban slum like near a house, and they probably haven't even had access to an education. So I'm like, if you being a medical doctor like aren't okay like discussing periods with your daughter, then what can we like expect from people who probably like never been through school or like never had any sort of like formal education. And I think slowly by just bringing up this topic repeatedly in my house, or like pushing back on some of the taboos or customs surrounding menstruation in my own household, I saw my parents' attitude begin to change, and especially my dad. I think he went from a place where he was like awkward discussing menstruation with me to a place where he now is such a big supporter of the work that we do with the Period Society. He'll often like drive me to sessions that we're having in India. He'll help distribute pads. He'll always like, talk about my work and try to connect me with people who he thinks might be aligned with our mission. So I think that's like a great example of how even when we necessarily think that people have grown up with these views for their entire lives and might have really rigid views, I think they're able to change. And it's something that takes time. It did not happen overnight for me, but like through repeated conversations over the course of all of these years, I've really gone from a place where the word period wasn't something we said aloud in my house to a point where it's really table talk for us now. And we also have a lot of men and boys actually who are taking the lead in the Period Society. And I think I always give the example of our Assam chapter, which is doing such amazing work. And it's one of our few chapters in the northeast of India. And it's actually led by Moshin, who's a man. And he's been doing amazing work organizing his community. And just the amount of vigor and regularity with which our Assam chapter does these sessions, and the way in which she's been leading it is like frankly phenomenal. So I feel like it's not just being an ally to this work, but I think men and boys are also like absolutely capable of stepping up in their communities to like lead the work or lead the initiative of educating those around them about menstruation. And when possible and permitted, even when we hold educational sessions in schools, we try to include boys in those educational sessions, because we don't just want to sort of preach to the choir and talk to girls about menstruation. But I think if we have to normalize menstruation, it's important even for boys at a young age to learn about what menstruation is. And we see a lot of curiosity from the boys we interact with, because they'll start asking questions, especially in a non-judgmental space. And they'll want to know more because there's no one who's ever talked to them about menstruation, or they think it's like not their place to ask questions about it. So I think especially like when we interact with like school children, trying to include men and boys in this work has like definitely been something that we see as paying off. And there's a long way to go, but I definitely like already see that change, and it's really encouraging.
Thank you so much, Swara, for joining us today and sharing your enlightening and inspiring words. We will carry your words with us as we continue our journey towards building a more equitable and compassionate world.
Thank you so much for having me.